Alright, I'm Hannah Gerkink, and this is my med administration video. So the first thing you're going to want to do after entering the patient's room is provide hand hygiene. Then you're going to introduce yourself to the patient and explain the procedure. So hi, I'm Hannah. I'm your nurse today, and I'm going to be giving you your medication Coumadin. After that, you're going to make sure the patient is in a comfortable position, preferably elevated, so it helps aid in the swallow of the medication. So we're going to sit Ms. Jenkins up. Is this a comfortable position for you, Ms. Jenkins?
Yes.
All right. After that, you're going to need to get 2 identifiers to verify the patient. So can you tell me your name and date of birth?
I'm Miss Jenkins, and my date of birth is January 7th, 1947.
All right. And Miss Jenkins, do you have any allergies?
No.
And how would you prefer to take your medication? All at once or individually?
All at once.
All right. So after we did that, we're going to want to ask Miss Jenkins if she's having any side effects from the previous dose of medication, and if she's still experiencing any pain. So Miss Jenkins, on a scale from 1 to 10, 10 being the worst pain, 1 being the least, can you rate your pain for me?
I'd say about a 3.
And earlier you said that you are having nausea after the first medication. Are you experiencing any other symptoms?
No side effects.
Okay. After that, you're going to teach the patient and their family about Coumadin. So Coumadin is an anticoagulant that prohibits the synthesis of vitamin K, which then therefore decreases the blood's coagulative properties. And explain to the patient why they are going to be taking this medication. So Ms. Jenkins, you're going to be on this medication because you have a history of atrial fibrillation, type 2 diabetes, and hypertension. So this will help decrease that blood pressure for you. You're also going to want to explain side effects that the patient or their family will need to look out for while taking Coumadin. So certain side effects that you will want to pay attention for is blood in the urine, vomit, dark tarry stool, and petechiae, which are little tiny marks underneath the skin, little bruises. And you will also need to explain certain dietary habits that the patient should follow during the taking of this medication. So Ms. Jenkins, you should not take aspirin with Coumadin because it will affect the absorption of Coumadin, and you shouldn't be taking or eating a lot of leafy green vegetables because those are high in vitamin K. After that, you are good to administer the medication. So you should do 3 checks. So 1 can be done outside the room when you first grab the medication. So you're going to look, see it says warfarin, 2.5 milligrams, PO at 1800. And then once you get into the room after you identify the patient, so warfarin, 2.5 milligrams, PO at 1800. And then when you're about to administer the medication for the patient, and you can supply some water for the patient to help take the medication. And you check one more time, warfarin, 2.0 milligrams, PO at 800, warfarin, 2.5 milligrams. And you can have Ms. Jenkins take the medication. Alright, and after that, you can come back in 30 minutes and check and see if Ms. Jenkins is having any side effects, or if she is having difficulty swallowing, you can aid in that. I'm Hannah Gerkink, and this is my med administration video.